Hello, I'm Robin Wing, Pediatric Emergency Medicine Physician at Hasbro Children's Hospital, Associate Professor at the Alpert Medical School of Brown University, Director of Pediatric Simulation at the Lifespan Medical Simulation Center, and co-founder and co-chair of the National Emergency Airway Registry for Pediatric Emergency Medicine, NEAR4PEM. On behalf of my co-authors, I'm pleased to be sharing our manuscript, published in Pediatric Emergency Care, Usability Testing via Simulation, Optimizing the NEAR4PEM pre-intubation checklist with a human factors approach. Tracheal intubation of critically ill children presenting to the emergency department is a life-saving but challenging procedure. Nearly 1/3 of patients require multiple attempts, and between 15 to 30% experience adverse events while undergoing tracheal intubation. Quality improvement efforts using airway management checklists have been associated with improved outcomes for children undergoing tracheal intubation in pediatric and neonatal intensive care units. However, the emergency department setting has unique features that distinguish both its patients and practices from intensive care settings. Our group, the National Emergency Airway Registry for Pediatric Emergency Medicine, or NEAR4PEM, has been using rigorous methodologies to develop a comprehensive pre-intubation checklist for PEDS emergency department use. This approach has included a modified Delphi approach to select checklist items, followed by human factors formative usability testing to optimize the design and create a prototype checklist. This current study is simulation-based usability testing followed by human factors heuristic inspection to create a checklist that is made to align with the clinician's bedside workflow and carefully designed to balance comprehensiveness and utility while not being overly prescriptive or time-intensive. This was a prospective, mixed-method study across 7 sites in the National Emergency Airway Registry for Peds Emergency Medicine Collaborative. PEM attending physicians and senior fellows at each site were first oriented to the checklist prototype. Each site used the checklist in 2 simulated cases, an easy airway and a difficult airway scenario. Facilitators recorded verbalization, completion, and timing of checklist items. After each simulation, participants completed an anonymous usability survey. Structured debriefings were used to gather additional feedback on checklist usability. Comments from the surveys and debriefings were qualitatively analyzed using a framework approach. Responses informed human factors-based optimization of the checklist. 55 PEM physicians participated. Overall, participants found the prototype checklist to be helpful, easy to use, clear, and of appropriate length. Detailed performance of individual items is included in the manuscript. Overall, during the simulations, 93% of checklist items were verbalized, and greater than 80% were completed. Survey and debriefing data identified several strengths, including facilitating a shared mental model, cognitively offloading the team leader, and prompting contingency planning. Suggestions for checklist improvement included clarifying specific item wording, providing more detailed prompts, and allowing institution-specific customization. Integration of these data with human factors heuristic inspection resulted in a final checklist. In conclusion, simulation-based human factors usability testing of the NEAR4PEM pre-intubation checklist allowed optimization prior to clinical implementation. Next steps involve integration into real-world settings, utilizing rigorous implementation science strategies with concurrent evaluation of the impact on patient outcomes and safety. The authors would like to thank all study participants and members of the simulation centers from the participating NEAR4PEM collaborative sites. Additionally, we acknowledge the contributions of members of the larger NEAR4Kids collaborative who provided feedback on this project, and Brown Emergency Medicine who funded the study through a faculty development grant.